Good afternoon. My name is Zainus. I'm one of the final year medical students. Can I start by just getting your name and your age, please?
Yeah, my name is Anas. I'm 55.
Okay. And how would you like me to address you?
Just Anas is fine.
Okay. It's very nice to meet you today, Anas. Today I've just been asked by the doctors in charge of your care to come and speak to you about what's brought you in. Just want to let you know everything we discuss is completely confidential and kept within the medical team.
Sure.
Does all that sound okay?
Yeah, that's fine.
And you're happy for us to proceed?
Yeah.
Great. So what's brought you in today, Anas?
Yeah, I mean, to be honest, I've been having this cough that I've been struggling to kind of shake off.
Okay.
Feeling a bit breathless with it as well.
Right. Okay. Just tell me a bit more about what's been going on.
Yeah, so I've been feeling breathless for about a week, I would say.
Mm-hmm.
It's a bit worse when I'm walking around, but it's not usual for me to feel breathless. Like I would say, I'm quite active. So I mean, it's just not kind of I'm not shaking it off really, which is why I'm a bit worried.
Okay, right. Well, you mentioned you're a bit worried, so we can address that. Anything in particular you're worried about?
I mean, nothing major. I suppose it's only been a week. My dad was a bit ill previously from kind of lung problems, so I just want to kind of reassure myself in terms of that as well. But yeah.
Okay. Well, I'm sorry to hear that happened to your dad. Do you mind me asking exactly what the situation was?
Yeah. So my dad was diagnosed with lung cancer at 75.
Okay. Right. Well, again, I'm sorry to hear that. I do just want to reassure you slightly. There are many causes of breathlessness and coughs, as you've been experiencing. The best thing for us to do is to take a full history, do the appropriate examinations and investigations, and that'll give us a much better idea as to what's going on.
Okay.
How does that sound?
Yeah, that's all right.
Besides that, anything else you're expecting to get out of today?
And not just find out what's going on, really. That's the big thing.
Well, let's just go back to the breathlessness. That can mean different things to different people. Can you explain exactly what you mean when you say breathlessness?
Yeah, it's just that I'm struggling to kind of just catch my breath, really.
Right.
Especially when I'm kind of when I'm walking upstairs, it's a bit worse. Even kind of getting to the GP today was a bit difficult. So.
Okay, so you're saying it seems to be getting worse when you're moving or walking around?
Yeah. So when I'm walking, really.
Yeah. Okay. Anything else that you noticed that makes it worse?
That's about it, really.
No. Okay. In particular, does lying flat make it worse?
No, not really.
No. Okay. And have you ever experienced yourself waking up in the middle of the night gasping for breath?
No.
No. Okay. And if you don't mind me asking, how many pillows do you normally sleep with at night?
Just 2 pillows.
2 pillows.
Yeah.
Okay. And you said this started about a week ago.
Yeah.
Have you ever experienced anything like this before?
No. I mean, as I said, I'm usually quite kind of fit. Like I go to the gym, I do a bit of cardio and stuff.
Okay.
So yeah.
Okay, that's good to hear. And over the last week, how would you say it's changed at all?
I'd say it's getting a bit worse, actually.
It seems to be getting worse.
Yeah.
Okay. And in what way is it getting worse?
I mean, initially it was just kind of. Initially, I wasn't as breathless. Now, just walking a bit of distance just kind of just makes it a bit worse, and that wasn't the case initially.
Right. So now it's just getting worse by it's becoming more common throughout the day.
Yeah, I would say so.
Okay. So I've asked you quite a few questions now. I just want to find out from yourself. Is there anything that you think might be going on?
I mean, as I said before, I am a bit worried about this whole like lung issue and stuff. But to me, it's only been a week, so potentially some kind of infection. I might have caught something from someone. I don't know.
Okay.
Maybe.
Yeah. And as we mentioned before, the best thing to do is what we're doing right now, and you've done the best thing by coming in today.
Thank you.
Just want to move on to asking you a bit about how your health has been leading up to today.
Yeah.
So in the last few weeks or months, have you noticed any weight loss?
No.
No. Have you noticed any sweating, particularly at night?
I do feel a bit warmer. I wouldn't say I'm sweating a lot more. But
No. Okay.
Yeah.
Have you had a fever at all?
I think I have. Yeah.
Okay.
I haven't measured it.
All right. Okay.
But I think my wife was saying, she felt my forehead and stuff, and she said I felt quite hot. So,
Felt quite warm. Okay. And when did you first notice that?
This was around the time when it started.
Okay. So about a week ago as well.
Yeah.
Okay. Have you taken anything to try to help with the fever?
Yeah, I've tried some paracetamol.
Okay. Did it help at all?
Yeah, it helped a bit. Yeah.
Okay. Have you noticed any change to your appetite?
No.
No. Okay. Have you had any pain in your chest?
No, I mean, just because I've been coughing a lot, I've been feeling some kind of just all over, really, kind of around the ribs and stuff.
Okay.
A bit of pain. but apart from that, no.
Okay. So pain just in the ribs, nowhere else?
Yeah, I would say it's like kind of on both sides, just, yeah.
Okay. Anything that seems to make the pain worse?
Not really. Coughing makes it a bit worse. Yeah, I feel like if I press around the chest as well, it can be a bit tender.
Okay. The pain isn't made worse by you moving around, by walking?
No.
No. Okay. And have you taken anything to help with the pain?
Not really. It's not bothering me particularly.
No.
But
Okay. And when did you first notice the pain?
this was maybe 2 days ago.
2 days ago as
Yeah.
well. Okay. And how would you describe this pain that you've been feeling?
It's just kind of a aching.
Aching.
A bit aching. Yeah.
Okay. Does the pain move anywhere else?
No.
Particularly up the neck or down the arm?
No.
Okay. And on a scale of 1 to 10, 1 being very little pain and 10 being the worst pain you can imagine, how bad would you say this
It's
pain
about
is?
5 maybe.
It's about a 5. Okay. If it does get worse, or you do feel like you need some painkillers, then do let us know and we can try and facilitate that. Okay. And you mentioned this cough that you've been having as well. When did you first notice that?
Yeah, this was at the same time it started about a week ago.
About a week ago.
Yeah.
Okay. Would you say that's gotten worse as well?
I stayed about the same, maybe a little bit worse.
Maybe a bit worse. Okay. Have you been coughing anything up?
Yeah, so like green sputum.
Green sputum. Yeah. Okay. Have you noticed any blood in the cough?
No.
No. Okay. Have you noticed any wheezing at all?
No.
No. Okay. Have you noticed any swelling in your legs?
No.
No. Or any pain or tenderness in your legs?
No.
No. Okay. Have you noticed any changes to your voice?
No.
No. Any difficulty swallowing? No. Okay. And do you know if you've been vaccinated for something called TB?
Is that the
BCG.
Yeah, that's the one. Yeah, I had that when I was a kid.
Okay, great. Thank you very much for answering all those questions. Just want to move on to asking you some questions about your general health.
Okay.
Is there anything you visit the doctor for regularly?
No, not really. No.
Okay. In particular, any problems with the lungs? For example, asthma or COPD? No. Any problems with the heart?
No.
No. Any high blood pressure?
No.
Okay. Is there any medications that you take regularly?
No, nothing really. I mean, I've been taking paracetamol whenever I get ill. Ibuprofen maybe, but apart from that, no.
Okay. But nothing regular?
No.
Nothing over the counter?
No.
No creams or ointments?
No.
Do you aware of any drug allergies that you have?
No.
No. Okay. Have you had any surgeries in the past?
No.
No. Okay. Just want to move on to asking you some questions about your family's health. Are you aware of any conditions that run in your family?
No, I mean just the lung cancer with my dad. Apart from that, nothing else really.
Okay. No one in the family has something called asthma?
No.
No. Okay. Or any problems with the lungs?
No, I don't say so.
Just want to ask you some questions about your social situation.
Yeah.
Are you working at the moment?
Yes, I work as an investment banker.
Okay. And has your work been understanding about your illness recently?
Yeah, I mean, I've been going into work.
Mm.
I did take a day or two off, but usually, because I don't take that many days off anyway, so they've been fine with it.
Okay, that's really good to hear. And I just want to ask you, have you travelled anywhere recently?
No, I went to Dublin a couple of weeks ago. But
Okay.
apart from
And
that, no.
were you fine when you came back?
Yeah, no issues really.
Okay. And these are just routine questions that we ask everybody. Do you drink at all?
No.
No. Okay. Do you smoke at all?
I used to smoke when I was younger, but not anymore.
Okay. And how long ago did you stop?
This was how long? I stopped when I was 25.
Okay. And how long did you smoke for?
7 years.
7 years. And roughly, would you be able to say how many you smoked a day?
Maybe like a cigarette or two a day.
Okay. And again, just routine questions that we ask everybody. Do you take any recreational drugs?
No.
Okay. Well, that's all the questions I have for you today. Do you have any questions for me?
No, so, I mean, what are we going to do from here?
So what I'll do is I'll discuss your case with the team, and from there we'll be able to formulate a management plan, and that will kind of detail how we're going to be going forward. Does that sound okay?
Yeah, sure.
Okay, great. Thank you very much for speaking to me.
Thank you.
Bye.
Okay, so can you summarize the patient and give your top 3 differentials?
Sure thing. So today I spoke to Anas, who is a 55-year-old gentleman who presented with a week-long history of breathlessness, cough and fever, all of which seem to be getting worse. The breathlessness is worse on exertion, but doesn't seem to be affected by him lying flat. The cough is productive of green sputum, but there is no hemoptysis, leg swelling or any recent surgeries. He has not been diagnosed with any medical conditions. However, he has been taking paracetamol to treat this fever. in terms of his family history, his father was diagnosed with lung cancer at the age of 75. He is also an ex-smoker with a less than 1 year PAC history. My top differentials would be a pneumonia. Other differentials would include a PE and also a viral upper respiratory tract infection.
Okay, thank you. So can you also tell me how you would investigate this patient and also a management plan?
Okay. So in terms of my investigations, I would start at the bedside with a full cardiovascular respiratory examination. I would then want to look at the patient's observations. This would include their heart rate, their respiratory rate, blood pressure, oxygen saturations and temperature. I would then move on to further investigate them with some blood tests. I would want to look at the full blood count, specifically at the white cells, and also I would want to look at their CRP as a marker of infection as well. I would want to then do urea and electrolytes, looking specifically at the urea, and I'd want to do an LFTs to establish a baseline. After this, to further investigate the possible infection, I'd want to do a sputum culture, and to rule out a possible pulmonary embolism, I'd want to do a D-dimer if we were in a GP setting. Now, assuming that the diagnosis is a pneumonia, I would want to manage this patient using the CURB 65 score and prescribe some antibiotics in accordance with trust guidelines. I would also want to possibly give the patient some oxygen based on their saturation results, and also some analgesia for their chest pain.
Okay, thank you for that.